Important notice. This video is provided for informational and educational purposes only. It does not substitute professional medical advice. Do you know what signs your skin may be sending about your health? As the most common type of cancer worldwide, it's crucial to pay attention to the signals your body may be sending through your skin, as these signs could be indicative of serious issues, such as skin cancer. Hello, if you're new here, don't forget to subscribe and turn on notifications to not miss any important content. The skin is the largest organ in the human body and acts as a protective barrier against external damage, including UV rays from the sun, chemicals, and infectious agents. However, it can also reveal important clues about an individual's overall health. In this video, we'll discuss 8 main signs of skin cancer and how to recognize them, so stay tuned until the end of the video to better understand skin cancer symptoms. Skin cancer is a condition in which skin cells multiply uncontrollably, forming malignant tumors. There are several types of skin cancer, with the most common being basal cell carcinoma, squamous cell carcinoma, and melanoma. Basal cell carcinoma. This is the most common type of skin cancer, accounting for about 80% of cases. It usually develops in areas of the skin exposed to the sun, such as the face, scalp, ears, and neck. Basal cell carcinoma tends to grow slowly and rarely spreads to other parts of the body, but it can cause significant damage if not treated early. Squamous cell carcinoma. This type of skin cancer is less common than basal cell carcinoma, but still quite prevalent. It is also caused by sun exposure and usually develops in exposed areas of the skin, such as the face, ears, neck, and hands. Squamous cell carcinoma can spread to other parts of the body if not treated early, but it is still highly treatable when diagnosed early. Melanoma. Although less common than basal and squamous cell carcinomas, melanoma is the most serious type of skin cancer. It develops from pigment-producing skin cells called melanocytes. Melanoma can occur anywhere on the body, even in areas not exposed to the sun, and is more likely to spread to other parts of the body. However, when diagnosed early, melanoma can be successfully treated, highlighting the importance of early detection and regular medical follow-up. Signs and symptoms of skin cancer. 1. Changes in the skin. Changes in the skin are one of the earliest warning signs of skin cancer. This symptom can manifest in various ways, including spots, moles, or wounds that show variations in size, color, or shape. Here are some aspects to watch out for. Size. Spots or moles that increase in size over time may be indicative of skin cancer. For example, a mole that grows significantly in a few months may be cause for concern. Rapid or disproportionate growth compared to the rest of the skin is a sign to seek medical evaluation. Color. Change in the color of spots or moles is another important indicator. Moles that become multicolored or develop different shades, such as black, blue, red, or white, should be examined. The presence of multiple colors in a single spot may suggest melanoma, the most aggressive type of skin cancer. Shape. Changes in shape or irregular edges are classic warning signs. Moles with irregular or undefined edges, or that become asymmetrical, deserve attention. Typically, benign moles have smooth edges and are symmetrical. Texture. Any change in texture, such as a mole becoming scaly, crusty, or ulcerated, may be a sign of skin cancer. Spots that develop an irregular surface or wounds that do not heal may be symptoms of basal or squamous cell carcinoma. 2. Non-healing wounds. Skin wounds that do not heal, bleed easily, or remain open for weeks are important warning signs for skin cancer. Normally, the skin regenerates quickly, but when there is a wound that persists or worsens, this may indicate the presence of cancerous cells interfering with the healing process. This symptom is common in basal and squamous cell carcinomas, which are types of skin cancer more frequently associated with sun-exposed areas. If you notice a wound that does not improve, consult a dermatologist for a detailed assessment and possible biopsy. 3. Changes in the nails. Changes in the nails, such as discoloration, abnormal growth, or deformities, may be signs of skin cancer, specifically subungual melanoma. This type of cancer affects the nail matrix, resulting in dark stripes or bands under the nail that do not fade over time. It can also cause lifting or detachment of the nail from the underlying skin. The presence of pain, bleeding, or irregular nail growth should be investigated immediately. These changes, although rare, are a potential indicator of malignancy and require evaluation by a dermatologist for accurate diagnosis and appropriate treatment. 4. Tingling or numbness sensation. The sensation of tingling or numbness in an area of the skin can be a concerning symptom and should be taken seriously. These abnormal sensations, known as paresthesias, may occur if a skin tumor is pressing on underlying nerves or invading deep tissues. Although tingling or numbness are not the most common symptoms of skin cancer, their presence may indicate that the disease is affecting local nerve structures. If you experience these sensations persistently in combination with other skin changes, it is essential to seek a dermatologist for a comprehensive evaluation and early diagnosis. 5. Rapidly growing lesions. Skin lesions that increase in size rapidly are an important warning sign for skin cancer. The accelerated growth of a lesion, whether a spot, mole, or nodule, may indicate that skin cells are dividing uncontrollably. This behavior is typical of melanoma, an aggressive type of skin cancer that can spread rapidly if left untreated. In addition to melanoma, other skin cancers, such as basal cell and squamous cell carcinomas, may also present rapid growth. If you notice that a lesion is growing quickly, it is essential to seek medical attention for a detailed evaluation and, if necessary, a biopsy. 6. Bleeding. Bleeding from a spot or skin lesion, without an apparent cause, may be an alarming sign of skin cancer. Malignant lesions, such as carcinomas and melanomas, may develop a delicate and prone-to-bleed surface, even with minimal irritation. This symptom may indicate that the lesion is invading tissues and blood vessels. If you notice that a mole or skin lesion begins to bleed spontaneously, it is crucial to seek immediate medical evaluation. Persistent bleeding, especially in areas not subject to trauma, is cause for concern and should be investigated to rule out the presence of cancer. 7. Changes in skin texture. Changes in skin texture, such as areas becoming scaly, rough, or thickened, may be early signs of skin cancer. Squamous cell carcinoma, for example, often appears as rough and scaly patches that may itch or bleed. These changes in texture are indicative that skin cells are multiplying abnormally and may develop into tumors. Paying attention to these changes, especially in areas frequently exposed to the sun, is crucial for early detection. If you notice any persistent changes in skin texture, consult a dermatologist for evaluation. 8. Itching, pain, or sensitivity. The presence of persistent itching, pain, or sensitivity in an area of the skin can be a concerning symptom of skin cancer. These sensations occur when cancer cells irritate surrounding tissues, triggering inflammatory or nerve damage responses. If you notice that a spot or skin lesion constantly itches, becomes painful, or is more sensitive to touch, it is essential to pay attention. These signs may not seem serious initially, but they can indicate that something is amiss with the skin. In the case of melanomas or carcinomas, such symptoms may indicate that cancer is developing or spreading. Persistence of these sensations, especially if associated with other visual changes in the skin, should prompt a visit to a dermatologist for evaluation. Detecting and treating skin cancer in its early stages significantly improves the chances of cure and treatment success. Regular skin surveillance and monthly self-examinations can help in the early detection of suspicious changes. Using the ABCDE rule, asymmetry, border, color, diameter, evolution, to monitor moles and spots can facilitate the early identification of possible signs of skin cancer. If any change is observed, consultation with a dermatologist is essential for diagnosis and appropriate treatment. We ask that you share this content with friends and family to help raise awareness about the importance of monitoring skin changes. Stay tuned for more content on health and well-being. Until next time.